Alright, hello, welcome back. We will continue our video series on pharmacology for health professionals. In this video, we will discuss chapter number 8, gastrointestinal drugs. Learning objectives for this chapter: differentiate between the therapeutic effects of antacid drugs, H2 blocker drugs, and proton pump inhibitor drugs in treating peptic ulcer disease. Describe how anticholinergic drugs work to treat diarrhea and gastrointestinal spasms from irritable bowel syndrome. Describe the therapeutic effect of narcotic drugs that is useful in treating diarrhea. Name 5 categories of laxative drugs and describe their therapeutic effects. Describe the ways in which antiemetic drugs treat different causes of nausea and vomiting. Describe the therapeutic effects of drugs that are used to treat obesity. When given the name of a well-known gastrointestinal generic drug, identify its trade name. When given the generic and trade names of a gastrointestinal drug, identify what drug category it belongs to and what disease it is used to treat. When given a gastrointestinal drug category, identify several generic and trade name drugs within that category. And lastly, when given an ending common to several generic drugs, identify the related drug category. First, we'll start with a quick introduction. Gastrointestinal drugs are used to treat diseases of the esophagus, the stomach, the small intestine, large intestine, the liver, and the gallbladder. Now, some diseases could include a peptic ulcer disease, Helicobacter pylori infection, gastroesophageal reflux disease, gastrointestinal spasms, and diarrhea. Some other common examples: hemorrhoids, constipation, ulcerative colitis, nausea and vomiting, hepatitis, gallstones, and obesity. First, we'll start off with drugs that are used to treat gastroesophageal reflux disease. It's also known as GERD, G-E-R-D. This is when the stomach acid flows backwards or refluxes back into the esophagus. This can cause esophagitis with irritation, inflammation, and pain because you are having a very strong acid, stomach acid, eating away at the tissue of the esophagus. This is treated with changes in the patient's diet and their lifestyle. It can be treated with antacids or H2 blockers or proton pump inhibitors or gastric stimulant drugs. See, antacid drugs for gastroesophageal reflux disease. Originally, this was the only treatment that was available. And the way these work are, antacids are weak bases that exert a therapeutic effect by neutralizing the hydrochloric acid from the stomach. So these act as a buffer. The pH of the gastric stomach is going to be very, very low because it's such a strong acid. So if you can neutralize that by raising the pH of the stomach contents. So this will decrease the strength of the hydrochloric acid, which will decrease the mucous membrane irritation. And this will also inhibit the action of pepsin, which is a major gastric enzyme. Now, antacid drugs contain individual or a combination of these following elements as their active ingredient. It could be aluminum, magnesium, calcium, or sodium. Now, antacids are available without a prescription. And some common examples of antacids that contain aluminum as their active ingredient would be Alternagel and Amphagel. And some common antacids that contain magnesium as their active ingredient would be Dulcolax and Phillips milk of magnesia. That leads us to a drug alert when it comes to Dulcolax. Now, normally, a trade name drug is associated with just one generic drug, but there's a very unusual exception to this when it comes to Dulcolax, which is associated with 2 different generic drugs. Dulcolax can be administered as a liquid, and in this form it contains the generic drug magnesium, and it's used as an antacid. And Dulcolax can also be an enteric-coated tablet or suppository, which contains the generic drug bisacodyl, which is an irritant or stimulant laxative drug. Now, antacids that contain calcium as their active ingredient would include Alkamints or Chews or Maalox antacid barriers, Tetralac extra strength, or Tums Ultra. And antacids that contain sodium bicarbonate as their active ingredient, Alka-Seltzer Gold, and Alka-Seltzer heartburn relief. Now, antacids can come in a combination drug, and these drugs would have combinations of the following components. It could be aluminum, calcium, magnesium, sodium bicarbonate, simethicone, and pain relief drugs. A combination antacid drug would be Alka-Seltzer. This is a combination of aspirin and sodium bicarbonate. Bromoseltzer, which is a combination of acetaminophen and sodium bicarbonate. Digel, which is a combination of aluminum, magnesium, and simethicone. Some other examples of combination antacid drugs: Gelusil, which is a combination of aluminum, magnesium, and simethicone. Maalox is a combination of aluminum, magnesium, and simethicone. Mylanta, also a combination of aluminum, magnesium, and simethicone, and Rolaids, which is a combination of calcium and magnesium. And a drug we've seen a few times already in this chapter, simethicone. This is available as a drug to help treat gas. Now, this drug has no antacid action, so this is something that you would find in the drugs Gas X or Mylanta Gas, Fazyme, or Mylicon. Okay, this brings us to another drug alert. Baking soda, which is sodium bicarbonate, dissolved in water, is an old home remedy that's been used to treat indigestion and heartburn. Now, although sodium bicarbonate does neutralize acid, it is not recommended as a long-term treatment for heartburn because it has very large amounts of sodium, and that sodium gets absorbed systemically. Now, typically, physicians will recommend the moderate use of salt, even for patients without hypertension and other medical conditions. However, even very common over-the-counter antacid drugs contain very large amounts of sodium. For example, one dose of the antacid drug regular Alka-Seltzer contains 1,700 milligrams of sodium, and one dose of bromoseltzer contains over 2,700 milligrams. So for patients who are on a low-salt diet, this exceeds the recommended daily allowance of sodium for the entire day just in one dose. So that's why using this as a method of treatment is not recommended in the long term. The use of calcium-containing antacid drugs can provide the additional benefit to women by supplementing calcium intake, especially according to the drug companies. One advertisement shows a woman taking an antacid drug for heartburn and saying, quote, "and it's something my body needs anyway." But in reality, the use of calcium-containing antacid drugs should not take the place of the adequate intake of calcium within a diet. Another type of drug that is used to treat GERD are H2 blocker drugs. And this H2, the H is reference to histamine. Now, histamine is a natural chemical that's produced by the body, and this will activate special receptors called histamine receptors, H2. And these are found in the parietal cells of the stomach. And the parietal cells are the cells that produce hydrochloric acid. So H2 blocker drugs are drugs that block these receptors and prevent the release of the hydrochloric acid. So that's why they're known as H2 blocker drugs. And these generally are prescription drugs, but there are some available over the counter. And these must be taken 30 minutes before a meal. See some common examples of H2 blocker drugs: cimetidine, which is sold under the trade name Tagamet; famotidine, which is sold under the name Pepcid; nizatidine, sold under the name Axid; ranitidine, which is sold under the trade name Zantac. Alright, this leads us to another drug alert. All H2 blocker drugs originally were approved only as prescription drugs. Then famotidine, which is Pepcid, became the first to be approved by the FDA for over-the-counter use. Now, each of the prescription H2 blocker drugs has a corresponding over-the-counter version, and the over-the-counter H2 blocker drugs are only approved by preventing and treating heartburn and acid indigestion. And some quick notes about the lettering that you'll find after the trade name's drug. In the trade name Axid AR, the AR actually stands for acid reducer. The AC in Pepcid AC represents a Latin phrase, antecebum, which means before meals, since Pepcid AC must be taken before a meal. And the HB in Tagamet HB stands for heartburn. Here are the prescription trade names and their doses. For Tagamet, they come in 300 milligrams, 400, and 800 milligrams. Pepcid is 20 or 40 milligrams. Axid is 150 or 300. And Zantac, 150 or 300. So these are all prescription doses. So these are going to be a little bit higher than your easily available over-the-counter versions. So it comes the over-the-counter versions of these. Tagamet HB is available in 200 milligrams. Pepcid AC is 10 or 20. Axid AR is 75. And Zantac is 75 or 150. Now, an over-the-counter drug is defined as one that can be purchased without a prescription and is generally considered safe for consumers to use, assuming they follow the label's directions and warnings are followed carefully. And the FDA can approve a prescription drug being reclassified as an over-the-counter drug only if a few criteria are met. So one of these is the indication for the drug's over-the-counter use is similar to its use as a prescription drug. The patient can easily monitor his or her own condition when using the over-the-counter drug. You know when your heartburn has gone away. You know when your indigestion has gone away. It's something that it's very easy for the patient to identify. Some other criteria. The over-the-counter drug has a low rate of side effects or toxicity and a low potential for abuse. And the use of the over-the-counter drug does not require the patient to have any special monitoring or any ongoing test. So there's no need to go into your clinic to have liver enzymes monitored every 6 months or every 3 months or once a year. And all of the over-the-counter H2 blocker drugs meet these requirements. That's why they're able to be reclassified as over-the-counter. All right, now a historical note. For many years, it was known that histamine was released during an allergic reaction. And this is what causes you to have the red eyes, the itchy eyes, the sneezing, runny nose. All the common allergic reactions that you get are due to the release of histamine. It was also known that histamine was released in the stomach, where it stimulated the production of hydrochloric acid. But this was not related to any type of allergic reaction. So therefore, researchers realized that histamine must act on 2 different types of receptors in the body. So that's why we have H1 receptors and H2 receptors. Because of the therapeutic effect of antihistamine drugs, such as Benadryl, for example, has been known since 1945, researchers at Smith, Kline, and French Drug Company began to search for a drug that could block the action of histamine on H2 receptors. Antihistamine drugs that you take for allergic reactions block H1 receptors. So developing a drug that would block H2 receptors would prevent the release of acid, and of course would be useful in treating peptic ulcers. So by rearranging the chemical structure of the molecule histamine, drug researchers developed a drug that combined with H2 receptors but would not activate them, thus effectively blocking the receptor and the release of acid. So that's why a drug that has this action is known as an antagonist. So it will physically block the receptor on the cell but doesn't turn it on. It basically gets in the way of the drug that would activate it. So that's why it is a blocker. It is an antagonist. All right, so in 1977, the first H2 blocker drug was created and given the generic name cimetidine. And from this generic name, we get the trade name, Tagamet. So you take the tag from the antagonist action of the drug plus the met of cimetidine, add those 2 syllables together, you get Tagamet. All right, some other drugs that are used to treat GERD are protein pump inhibitor drugs. Now, these will decrease the production of hydrochloric acid in the stomach. And some are used to treat heartburn and peptic ulcers. And all types of this class of drugs are used to treat esophagitis and GERD. Are some common examples of proton pump inhibitor drugs that are used to treat GERD: esomeprazole, which is sold under the trade name Nexium; lansoprazole, which is sold under the name Prevacid; omeprazole, which is sold under the name Prilosec; pantoprazole, which is sold under the name Protonix; and the last one listed here, rabeprazole, which is sold under the name Aciphex. Just like other conditions we've seen so far, it's common to find combination drugs that are used to treat GERD. For example, the drug Zegerid. This is a combination of a proton pump inhibitor drug, omeprazole, which is the generic name for Prilosec, and also the antacid drug, sodium bicarbonate. Another type of drug that's used to treat GERD are gastric stimulant drugs. And these are used to increase the rate of gastric emptying. Now this keeps excess acid from accumulating within the stomach and also refluxing back into the esophagus. An example of this class of drug would be metoclopramide, which is sold under the trade names of Reglan, Maxolon. I'll now move on to drugs that are used to treat peptic ulcer disease. Now, a peptic ulcer is caused by irritation of the mucous membranes that line the gastrointestinal tract. So these can be found anywhere within the esophagus or the stomach or the duodenum, which is the first part of the small intestine. And what happens here is excessive amounts of hydrochloric acid basically eat away at the protective lining of the mucous membranes. And after that, you have subsequent action of pepsin begins to break down the underlying tissues. There are some common products that can contribute to the formation of an ulcer because they irritate the mucous membranes, and some of those products would include aspirins, NSAIDs, non-steroidal anti-inflammatory drugs, alcohol, and caffeine. So if you have any type of peptic ulcer, any one of these will make it feel a lot worse. Drugs that are used to treat peptic ulcers. These are the proton pump inhibitor drugs for peptic ulcer disease. Esomeprazole, which is Nexium; lansoprazole, which is Prevacid; omeprazole, which is Prilosec; and rabeprazole, which is Aciphex. Alright, this leads us to focus on healthcare. Now, patients that arrive at an emergency room with a bleeding peptic ulcer have to be treated in a very particular way. They're given intravenous H2 blocker drugs to decrease the amount of acid within the stomach. They're also given a GI cocktail, which is liquid lidocaine, antacids, and antispasmodics. So once these patients leave the ER and are discharged to go home, they can take over-the-counter proton pump inhibitors such as Prilosec, for 1 month. If there's no improvement after that point, they should seek treatment for a possible H. pylori infection. And H. pylori is a bacterium that leads to the development of ulcers. And something like Prilosec would have no impact on that because it's not an antibiotic. See some other drugs that are used to treat peptic ulcer disease. Some of these will act topically on the surface of the ulcer because they are attracted to the areas of the mucous membranes that have been damaged or that are draining fluid because they're high in protein. And these drugs will actually bind directly to these areas, forming a protective layer or a bandage, if you will, over the ulcer, allowing it to heal. An example of a drug that would work in this way would be sucralfate, which is sold under the trade name Carafate. And now we'll talk about drugs for peptic ulcer disease that are caused by H. pylori infection. H. pylori is a helical or spiral shape of bacteria that have flagella. And these are found in the gastric or the duodenal mucosal layers. And these are the cause of some peptic ulcers. Now, a successful treatment of this would involve the use of a combination of drugs, such as antibiotics, antiprotozoal drugs, or bismuth. Now, these will disrupt the cell wall that surrounds the bacterium, which will lead to these cells' death. And the only drugs that are indicated for the treatment of H. pylori infections are the H2 blocker ranitidine and the proton pump inhibitors Nexium, Prevacid, and Prilosec. As he mentioned earlier that there are combination drugs that are used to treat H. pylori infections. These would be a combination of antibiotics such as amoxicillin, clarithromycin, tetracycline, an anti-infective drug like bismuth, and also an antiprotozoal drug such as metronidazole. It may also include the protein pump inhibitor drug lansoprazole, which is Prevacid. Some examples of these combination drugs: Helidac, which is a combination of bismuth, tetracycline, and metronidazole; Prevpac, which is a combination of amoxicillin, clarithromycin, and Prevacid; Pylera, which is a combination of bismuth, metronidazole, and tetracycline. Leads us to a drug alert. Now, some drugs are used to treat a wide range of different types of diseases. So it is important to mentally allow yourself to associate a drug with more than just one single therapeutic use. For example, the antiprotozoal drug, metronidazole, is used to treat many different diseases other than H. pylori infection of the stomach. Now, this drug is sold under the trade name Flagyl. Now, this drug is taken orally to treat infections of amoebas, which is called intestinal amoebiasis. It's also used to treat pelvic inflammatory disease. Now, the drug Metrogel vaginal is applied vaginally as a gel to treat vaginal bacteriosis, and Metrogel is applied topically to the skin as a gel to treat acne rosacea. So even though it's easy to associate one drug with one therapeutic effect, it's important to remember one drug can have any number of effects on different parts of the body. Okay, now we'll talk about drugs that are used to treat diarrhea. Now, antidiarrheal drugs produce a therapeutic effect by slowing peristalsis in the intestinal tract, and that's done by using anticholinergic drugs. And they also act by absorbing extra water from the diarrhea stools, and that's done so by using absorbent drugs. Now, some drugs exert their effect because they contain opium, which is a narcotic. It's commonly used for their pain-relieving properties. Now, opium is the source of heroin, also the source for morphine. Now, a common side effect is constipation, which is where the therapeutic effect comes into play. Now, when diarrhea is caused by an infection somewhere in the GI tract, antibiotic or anti-infective drugs are given. When it comes to anticholinergic drugs that help treat diarrhea, these are over-the-counter drugs that will decrease the rate of peristalsis in the GI tract. An example of this kind of drug would be loperamide, which is sold under the trade name ammonium AD or Kpec-2. When it comes to absorbent drugs that help treat diarrhea, these are over-the-counter drugs that contain atapoljite, which is an absorbent drug used to absorb the excess water that's found in the diarrhea stool. Some kind of examples of this kind of drug would be kaopectate, maximum strength, and Kpec. Another type of drug that would be used to treat diarrhea are narcotic drugs. These are the antidiarrheal drugs that contain opium, and these are classified as a controlled substance. These are a Schedule III drug. So these drugs would be considered to be paregorics because they contain opium. Antibiotic, anti-infective drugs that treat diarrhea. These are drugs that are used to treat infections associated with either bacterial or viral or protozoal diarrhea, and also traveler's diarrhea. Some examples of this class of drug would be bismuth, which is sold under the name kaopectate or Pepto-Bismol; ciprofloxacin, which is sold under the name Cipro; doxycycline, which is sold under the name Vibratabs or Vibramycin; and the last example here, trimethoprim or sulfamethoxazole, and this is sold under the name Bactrim or Septra. It's common to see combination drugs that are used to help treat diarrhea. These will include an anticholinergic drug to help reduce the rate of peristalsis, such as atropine, and also contain an absorbent drug to help absorb the excess water within the stool. So that could be pectin or ch8 or kaolin. It could also include an anti-infective drug, such as bismuth, or could include a Schedule 4 or Schedule 5 narcotic to help slow peristalsis, such as diphenoxin or diphenoxylate. Some examples of combination drugs for diarrhea: ammonium multi-symptom relief. This is a combination of loperamide and also simethicone. Capectilin, which is a combination of kaolin and pectin. Lomotil, which is a combination of atropine and diphenoxylate. And Modafin, a combination of atropine, diphenoxin. Alright, now we'll talk about the different types of laxative drugs. Now these are used for the short-term treatment of constipation. Now in addition to taking these drugs, attention should be given to adequate water intake by the patient, their dietary fiber and bulk intake, and other measures that are used to promote bowel regularity. Alright, the first type of laxative drugs we'll talk about are osmotic laxatives. And these use the process of osmosis and osmotic pressure to attract water from the blood into the intestines. By doing so, this will help soften up the stool. Another class of laxatives will be the bulk-producing laxatives. These contain an indigestible dietary fiber and other substances that absorb and hold water in the intestines to help soften the stool. Now, these are the most natural and the safest of all types of laxative drugs. Some examples of this type of laxative drug would be methylcellulose, which is sold under the name Citracel, polycarbophil, which is sold under the name Fibercon, psyllium, which is sold under the names Fiberol or Metamucil or Pyridium. Another type of laxative drugs are stool softeners. These are emulsifiers that allow fat into the stool to mix with the water to help soften the stool. An example of this would be Docusate, which is sold under the trade name Colase or X-Lax stool softener or Surfac. Another type would be polyethylene glycol or PEG, and that's sold under the trade name of Miralax. So another kind of laxative drugs, chloride channel laxatives. These will help stimulate chloride channels in the mucosa of the intestinal wall. And by stimulating these channels, this causes fluid to flow into the intestine to help soften the stool. An example of this kind of drug would be lubiprostone, and this is sold under the trade name of Amitiza. Another kind of laxative drugs are the irritant stimulants laxatives, and these act directly on the intestinal mucosa to help stimulate peristalsis. Some examples here would be bisocodyl, which is sold under the trade names Crectol, Dulcolax, or Phenamint, Carskera. Another example would be Senocot, which is sold under the trade names Maximum Relief X-Lax, Fletcher's Castoria, Senocot. And the last kind of laxative drugs we'll talk about are the osmotic laxative drugs. And these use the process of osmosis and osmotic pressure to attract water from the blood into the intestines, which will help soften the stool. Now, some of these drugs are over-the-counter, and some are by prescription only. Some examples of over-the-counter osmotic laxatives are milk and magnesia. It's sold under the names MOM and Phillips Milk and Magnesia. An example of a prescription-only osmotic laxative would be lactulose, which is sold under the trade name of Sifilac. Alright, now we'll talk about drugs that are used to treat diseases of the intestines. First one, we'll talk about ulcerative colitis. This is a chronic disease of the colon and of the rectum, and the cause of this condition is unknown. Another example, Crohn's disease. This is a chronic disease of the ileum and of the colon. And in this condition, you have areas within the ileum and of the colon that are inflamed, then they'll be followed by tissue that is normal, and the cause for this disease is also unknown. Now, both ulcerative colitis and Crohn's are characterized by some very common symptoms: diarrhea, abdominal pain, inflammation, and ulcers. And these will be treated with antispasmodics and drugs to help decrease the inflammation. Some drugs that would be used to treat ulcerative colitis are called 5-aminosalicylic acid drugs, and these work by decreasing the intestinal inflammation by blocking the production of prostaglandins. And these drugs will contain the active ingredient of 5-ASA, 5-aminosalicylic acid, or an ingredient that is metabolized by 5-ASA by the bacteria naturally found within the colon. Now, these kinds of drugs can be administered either orally or rectally, either as a suppository or as a solution. Some examples of this type of drug: balsalazide, which is sold under the trade name Colazol; mesalamine, which is sold under the names Asacol or Lialda or Pentasa or Rawasa; osalazine, which is sold under the name Dipentum; and the last one here, sulfasalazide, which is sold under the name azulfadine. Another kind of drug that could be used to treat ulcerative colitis: corticosteroids. Now, these have a more powerful anti-inflammatory effect than the aminosalicylic acids would. and these would be administered as an aerosol foam that is placed into the rectum. So examples of this type of drug: betamethasone, which is sold under the name Celestone; budesonide, which is sold as Entocort EC; hydrocortisone, which is sold under the name Cortifoam; methylprednisolone, which is sold under the name Medrol; and prednisolone, which is sold under the names Pediapred and Orapred. Now, the drugs that are used to treat Crohn's disease, these could include monoclonal antibody drugs or antibiotic and antiprotozoal drugs. When it comes to the monoclonal antibody drugs, these could include adalimumab, which is sold as Humira; certolizumab, which is sold as Cimzia; infliximab, which is sold as Remicade; and also natalizumab, which is sold as Tisabri. An example of an antibiotic or antiprotozoal drug that could be used here: metronidazole, which is sold under the name Flagyl. The drugs that would treat irritable bowel syndrome, and this is a chronic disease of the colon characterized by cramping, severe spasms, abdominal pain, bloating, having excessive mucus secretion, and alternating back and forth between having diarrhea and having constipation. There are several different types of drugs that would help treat IBS. You can have serotonin receptor blockers, such as losatron, which is sold under the name Lotranex. You can have a chloride channel activator drug, such as lubiprostone, which is sold under the name Amitiza. You have antispasmodic drugs, such as dicyclomine, which is sold under the trade name Bentyl, or hyoscyamine, which is sold under the name Levbid or Levsin. You also have guanylate cyclase C agonist drugs. An example of this would be linaclotide, which would be sold under the name Linzys. You can also use antibiotic drugs, such as rifaximin, which is sold under the name Xifaxan. Alright, now we'll move into antiemetic drugs. Antiemetic drugs are used to control nausea and vomiting. Now, this can be associated with many different diseases. And these can also be caused either by a viral agent or a bacterial agent. And these can directly irritate the intestinal mucosa, which will lead to the nausea and vomiting. Now, the irritation of the intestinal mucosa will stimulate the chemoreceptor trigger zone and the vomiting center within the brain. Now, some causes of this could be chemotherapy or radiation or certain types of drugs. Surgery, in particular abdominal surgeries, can temporarily stop peristalsis. So when this happens, you have fluids will accumulate within the GI tract. This can cause distension and pain within the belly. And along with this, you get postoperative nausea and vomiting. Now, patients who are actively vomiting and cannot take oral drugs can be given an antiemetic drug in the form of a rectal suppository. And some drugs that are used to treat nausea and vomiting actually work because they block dopamine. They block dopamine from activating receptors within the wall of the GI tract, or they can block dopamine in the chemoreceptor trigger zone, or they can block dopamine in the vomiting center of the brain. Examples of antiemetics: aprepitant, which is sold as the trade name Amend; chlorpromazine, which is sold under the name Thorazine; dolasetron, which is sold as Anzimet; haloperidol, which is sold under the name Haldol; ondansetron, which is sold under the name Zofran; palonosetron, sold under the name Aloxi; promethazine, which is sold under the name Phenergan; and the last one listed here, trimethylbenzamide, which is sold under the trade name Tigan. Now, there are some antiemetic drugs that are specifically used to treat the nausea and vomiting that are caused by chemotherapy drugs, because that is a common side effect of chemotherapy. You can also have antiemetic drugs that are specifically for vertigo or motion sickness. Now, motion sickness is when you have a repetitive but a varying motion of a car or a boat or an airplane that overstimulate the inner ear. And this will end up activating the vomiting center within the brain. And vertigo, this is a sensation of being very lightheaded or dizziness or a whirling sensation. This is caused by irritation or an infection of the inner ear. And this upsets the balance and stimulates the vomiting center of the brain. So when it comes to using antiemetics for motion sickness or vertigo, they work because they block the inner ear stimuli from reaching the chemoreceptor trigger zone and reaching the vomiting center of the brain. And they also work by reducing the sensitivity of the inner ear to motion in general. These kinds of antiemetics that treat vertigo and motion sickness can be given orally or in a transdermal patch. Some examples of this kind of drug that's given orally: cyclazine, which is sold under the name Marazine; dimenhydrinate, which is sold under the well-known trade name Dramamine; and meclizine, which is sold under the name Antivert. An example of this type of drug that can be delivered as a transdermal patch and is worn just behind the ear would be scopolamine, which is sold under the name Transderm Scope. Alright, now we'll talk about drugs that are used to treat obesity. The drugs that are used to treat obesity act in one of two separate ways. They can either keep dietary fat from being absorbed in the intestines, or they can suppress the appetite to decrease the total amount of food being eaten. The type of drug that would be used here are lipase inhibitor drugs. And these work because they chemically bond to the enzyme lipase. And the enzyme lipase is used to break down lipids or dietary fats. So if they can't be broken down, they end up being excreted in the stool as opposed to being absorbed. An example of this kind of drug would be orlistat, sold under the trade name Ali or Xenocol. When it comes to appetite suppressant drugs, these are similar in their chemistry to amphetamines, but obviously having less addictive properties. And they suppress the appetite by affecting the levels of dopamine or serotonin levels in the satiety center of the brain. These are also known as anorexiant drugs. Now these are limited to short-term treatments of obesity in conjunction with dietary restrictions. So you can't just rely on appetite suppressant drugs. There has to be in conjunction with other forms of treatment. And if these kinds of drugs are discontinued abruptly, the patients may develop a drug dependence or could experience withdrawal symptoms. So appetite suppressant drugs are classified as Schedule 3 and Schedule 4 drugs. Some examples of this would be bensphetamine, which is sold under the name Thidrex, lorcaserin, which is sold under the name Belvic, phentermine, which is sold under the name Prelude 2, and phentermine, which is sold under the name Profast. So another type of antisuppressant would be an antidepressant. An example of that would be bupropion, which is sold as the name Wellbutrin. In addition to those, you can have combination drugs that are used to treat weight loss. So you may see a combination of a Schedule 4 drug along with an anti-seizure drug. An example of this would be quicemia, which is a combination of phentermine and topiramate. You can also have a combination of a narcotic antagonist and an antidepressant drug, such as Contrave, which is a combination of naltrexone and bupropion. It leads us to a drug alert. The drug Ali is the first over-the-counter FDA-approved drug for weight loss. Now, in its advertising, the slogan was, "You provide the will, we provide the way." And the drug name is meant to imply that the drug is your ally or helper as you lose the weight. And it contains the same drug as prescription weight loss drug Xenocol, but at a lower dose. Because Ali acts to decrease the absorption of 25% of the fat in the diet, it produces stools that are fatty and can pass involuntarily. And the drug company that makes this has been upfront about the possible side effects of the drug, even going so far as suggesting that first-time users wear dark-colored pants or bring a change of clothes with them when they go out, just in case this were to happen. Now, some patients and counselors, however, see this as a positive effect, that the drug warns patients not to eat fatty foods, because you get penalized if you do. Now, most consumers think of weight loss drugs as relatively safe and free of side effects, but that's not always the case. The popular appetite suppressant drugs Accutrim and Dexatrim were taken off of the market because they contained phenylpropanolamine, which is a drug that caused hundreds of hemorrhagic strokes and even some deaths. In 1997, the FDA removed from the market the popular weight control drugs Pondamin and Redux. So the weight loss drugs that have been recently approved by the FDA include Belvic and quicemia. Okay, that brings us to the end of this video for chapter number 8. We will continue our video series on pharmacology with our next video on chapter number 9, musculoskeletal drugs.